Available nationwide.
My Lord, show me right from wrong. Give me light, make me strong. I know the road is long. Make me strong.
Assalamu alaikum wa rahmatullahi wa barakatuhu. May the peace, mercy and blessings of Almighty God be with you. And welcome to another episode of Doctors in the House. I'm your host, Dr. Muhammad Rahman, and it's great to have you with us again. So I've noticed a lot of media attention being focused on H1N1, the swine flu. And I sense some degree of panic on a public level. So let's start off tonight's show discussing H1N1. Firstly, let's step back a bit here. There are many types of viruses that affect the human body in a variety of ways. They can cause warts, common cold symptoms, immune deficiency, or even some types of cancer. What we refer to as the common cold can be caused by viruses like coronavirus, rhinovirus, and others. These tend to affect the upper respiratory tract. That sneezy, coughy, sniffly, headachy, with or without sinus congestion and fevers type illness. Mind you, various strains may cause different patterns of illness with even more symptoms. Influenza-type viruses like influenza A and influenza B tend to cause, in addition to some of the common cold symptoms we just mentioned, more severe body aches and fevers, together with lower respiratory tract symptoms in the majority of people. Now, these, like all viruses, mutate and change all the time. They are constantly evolving. Influenza A mutates around 3 times as fast as influenza B and tends to cause a more severe illness. These are designated with an HN code, and these help to identify more virulent or more dangerous subtypes. You might remember the bird flu a few years ago. That was the H5N1 strain. That was because it was identified in a bird population outbreak. Like all influenza A viruses, it is transmitted through birds, humans, and some other mammals. The current designation of H1N1 as swine flu is because it was originally discovered during a swine population outbreak, an endemic in a swine population. These viruses are always around and always mutating, and you may actually already have had an influenza A type viral illness, but thought of it maybe as a really bad cold or really bad virus. I myself had the swine flu in 2010 after a short vacation in Miami. I was tested for influenza A and tested positive. That's right. I didn't test positive for swine flu. Nobody actually tests positive for swine flu locally because we don't test specifically for the H1N1 subtype. But it doesn't really matter because the effective risk of disease course and complications are virtually the same. Our statistics might be skewed, but it certainly didn't matter to me when I had it. It was terrible. Talk about bone pain and cold sweating, but I digress. The more important thing to remember is that sometimes viruses can affect people in different ways, in some instances triggering severe respiratory or breathing problems like ARDS, acute respiratory distress syndrome, or other multi-system disorders. Our condolences go out to relatives of those 7 persons who died of complications of an influenza A type illness, probably H1N1. Now, in the very young or in the very old, it can cause serious problems since their immune systems may not be fully functional. Pregnant women are also at high risk since they have a higher than usual demand on their bodies. Persons on certain medications which suppress the immune system like methotrexate or azathioprine for diseases like rheumatoid arthritis or lupus or psoriasis are also high-risk populations. That is, they have a high risk of complications with an influenza-type viral illness. So, how do we treat this? Well, for the vast majority of people, simple analgesics like paracetamol, that's Panadol or Tylenol, fluids and bed rest will suffice. You should, however, see a doctor urgently if you or someone you know develops, in addition to the symptoms we mentioned so far, severe or worsening shortness of breath, confusion, or is unable to swallow fluids or to take in nutrition, at least fluids, or develops new seizures or abnormal bleeding or bruising or worsening of any chronic medical condition. These persons need to see a doctor right away, even if they suspect they have just a regular viral illness. In persons at high risk of complications, like those we just mentioned, or those with coexisting heart failure, or COPD, or asthma, or other conditions who present within 48 hours, within 2 days of onsets of symptoms, well, for them, a medication called oseltamivir, or Tamiflu, is prescribed. And this is actually used for any type of influenza-type illness. This helps to prevent viral replication, or the replication of the virus in the body, and it helps to shorten the course of the illness. This drug, however, Tamiflu, does not appear to reduce the number of hospitalizations that occur. And there appears to be no evidence of reduction in complications of influenza, such as, for example, ARDS or pneumonia. Simply put, the best treatment is prevention. And how can we prevent it? Well, avoid close contact with people who are sick. When you are sick, keep distance from others to protect them from getting sick too. If possible, stay home. Stay home from work, school, and even errands that you might have to run if you are sick and if you have symptoms of the flu. This will help to prevent spreading your illness to others. Cover your mouth and nose with a tissue when you cough or sneeze. It may prevent those around you from getting sick. Washing your hands will help protect you from germs. If soap and water aren't available, use an alcohol-based hand rub. Avoid touching your eyes, nose, or mouth unless you've washed your hands. Germs are often spread when a person touches something that is contaminated with germs and then touches his or her eyes, nose, or mouth. These represent areas in which the virus can enter the body. Practice other good health habits. Clean and disinfect frequently touched surfaces at home, work, or school, especially when someone is ill. Get plenty of sleep, be physically active, manage your stress, drink plenty of fluids, and eat nutritious food. Now we come to the highly contentious topic of vaccination. Now, vaccination for the H1N1 virus, vaccination for influenza A-type viruses is necessary in high-risk groups. In the high-risk groups, for example, we mentioned earlier on, to help prevent the complications that can arise as a result of this illness. But it is not absolutely necessary for everyone to get vaccinated. Flu vaccines have actually been around for a very long time. They take the most common types of viruses that are available and they develop antibodies to them. And then they sell it as a flu vaccine every year. And recently the popularity has skyrocketed, and I'm very pleased to hear that the Ministry of Health has vaccinations for high-risk members of the public free of charge. If you want it otherwise, you'll have to pay for it, like everyone in every other country in the world. And to quote someone that I frequently see on cable these days, just because we want something does not mean that we are entitled to it. And that'll be it for my introductory segment this evening. I hope that we were all able to learn something about H1N1 and influenza-type viruses, how we can prevent them, what can happen, what all the hullabaloo is about. We have an exciting show for you this evening. I'm actually really looking forward to it. I have some colleagues, some representatives from the various regional health authority doctors associations. And this evening, we're going to be taking the opportunity to talk about the doctor's perspective in healthcare. Don't go away. We'll be right back. Before I go, though, I would like to advertise something for IBN. There's going to be an IBN camp 2016. It's at the recreation grounds here at Bamboo number 2. Ages 4 and up, you're welcome to bring your kids. It's free to the general public. It'll be running from 1 p.m. on Sunday, the 7th of February, to 3 p.m. on Tuesday, the 9th of February. Be sure to bring your camping tents and stay overnight or stay in one of the tents provided. And breakfast, lunch, dinner, and snacks will be provided. Register now at the numbers at the bottom of your screen. This is going to be fantastic. All right. And we'll be right back after these messages to speak to some of our colleagues about the doctor's perspective. Be right back.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
I'm a cool kid, you're a cool kid, we are cool kids, are you a cool kid? Every day I want it, I need to drink lots of it, full of fruit, vitamin C, give me lots of it. My imagination is growing and so am I, I'm getting big. So give me fruit of cool kids, it's so juicy, so I can touch the sky.
Become a cool kid now by visiting www.fruitycoolkids.com.
Don't miss out on Amaral's Carnival All-Inclusive Getaway, February 5th to the 9th in Boca Chica, Punta Cana or La Romana. Call Amaral's Travel today at 665-3383, starting from $5,550 per person based on triple occupancy. No visa required, non-stop flights, eat and drink all you can. Limited space still available on escorted tours to Dubai, Abu Dhabi and India. Call Amaral's Travel at 665-3383. Also available, great deals to Cuba, St. Lucia, Barbados, Grenada and Curacao. Visit Amaral's Travel at Chigonas, Valpark, San Fernando or Port of Spain or online at www.amaralstravel.com.
Good evening and welcome back to Doctors in the House. So, as I promised, we have a very exciting show for you this evening. We have doctors who have recently actually formed staff associations within the various regional health authorities in an effort to represent the needs of the doctors within these institutions and to address some of the specific issues or some of the issues specific to these institutions. Welcome, gentlemen. And Kesh Golan, and they'll tell us a little bit about themselves very shortly. Then we have immediately to his left, Dr. Richard Spence, distinguished gentleman, Dr. Kevin Khan Kernahan, and Dr. Vijay Mahabir. So, gentlemen, let's start off the show with telling us a little bit about yourselves, where you are right now, what you're doing. I'm not from the staff association point of view, but how about your profession? What do you do on an average day?
Well, I've not too long completed the first part of my DM Orthopedics, which is postgrad training in orthopedic surgery, and I'm currently a Part 2 resident at Mount Hope, which is the Eric Williams Medical Sciences Complex, and I'm training in orthopedic surgery there. Daily activities basically would be treating patients in clinic, dealing with patients on the ward, dealing with emergencies in orthopedics. Yes, there are emergencies in orthopedics. We'll allude to that a little bit later.
We probably have to explain what orthopedics is.
Fair enough. The specialty actually is split into trauma and orthopedics, to be quite fair. Trauma would be emergencies, so you're looking at things like broken bones, ruptured tendons, injured nerves, whereas the orthopedic side of it is actually more what we would call elective. So you would treat things that do not necessarily threaten life or limb at that time. So we're looking at things like joint replacement, anything with respect to correcting the angles of bones. Those things would all fall into the category of orthopedic surgery.
Excellent. Dr. Spence, Richard, tell us about what you do.
Right. Good evening, Trinidad and Tobago. I'm from the Port of Spain General Hospital, and I am a member and president of the Northwest Doctors Association. Currently, I am in the general surgery department, and we handle things such as appendicitis, colon cancer, breast cancer, hernias electively, and those type of procedures. So it's a nice range of what you call elective or planned procedures and emergency type of procedures, and of course all the trauma that, of course, that surrounds the Port of Spain and environs, unfortunately. I'm actually enrolled as a student, as a postgraduate student in the University of West Indies. I'm allowed to study the same general surgery, and I'm about to write exams later this year.
Fantastic. Dr. Kevin Kernahan, tell us.
Hi, good night. Right, so I work in Mount Hope. I'm in the anesthetics and intensive care department. So basically what we do from the anesthetics point of view, we basically provide anesthetic services for surgical colleagues, which would be putting their patients to sleep for them to facilitate surgeries, as well as addressing the pain needs of the patients during and post-operatively. From an intensive care, in addition to the anesthetics, we provide basically organ support during surgeries, and by extension, in the intensive care setting, when we have critically ill patients, we basically provide intensive organ support and monitoring to patients, giving them the opportunity to recover.
Excellent. And Vijay Mahavir.
Good night to everyone. Like my colleague Dr. Golan, I am a final part DM candidate in orthopedic surgery from the University of the West Indies. I'm an acting registrar at the San Fernando General Hospital Orthopedic Department and the incumbent president of the Southwest Doctors Association. My daily activities, pretty much similar to Rakesh, engaged in fixing bones, tendons, pretty much those sort of things.
Fantastic. And we have another member of the panel who's off camera because we've run out of chairs. This is actually, as I understand, the largest panel that we've ever had on Doctors in the House, and we're very happy to say that. So there's Dr. Fidel Rampasad as well, who is representing the Eastern Regional Health Authority, and he'll be on the panel with us very shortly or in some time. So guys, let's get a little bit personal. The topic today is the doctor's perspective on healthcare. Tell us a little bit and let the audience get to know you. What made you want to get into medicine? What made you want to choose this profession? Not whether or not you've changed your mind since then. That's a different topic. So, Dr. Golan, who is the of the NCDA, the president? Vice President of the North Central Doctors Association.
Correct.
And Dr. Kernahan is actually the president of the North Central Doctors Association.
That is
so
correct.
What led you into this field, Dr. Golan?
Well, to break from tradition, I know most people who get into the medical field like to quote, "I want to help people," and I know that I think all of my colleagues would agree that's something we all have in common, that we want to help people, we want to help you. But my journey was not that glorious. Actually, when I was, and this is partially hilarious to me, but because it is true, when I was about 10 years old, there was a lady passing along in a wagon reading hands, and my mother insisted that she read my hand, and she immediately prophesied that I would be a doctor or a lawyer. much to my mother's happiness, of course. Typical Indian parent, she wants her child to be a doctor or a lawyer. And it went from there. And when I finished my advanced levels at Presentation College in Chaguanas, I looked at my friends and asked them what they were signing up for. And they were doing medicine, so I said, okay, I'll do medicine too. And I ended up in medical school. But I've always believed in the divine. I've always believed that we have a higher purpose, and I believe that I was guided by the divine hand at that point in time. And I can see myself doing absolutely nothing except medicine at this point in time.
Excellent.
And that's how I got here.
Great. And Dr. Golan and myself were actually in medical school together. We spent many a night over in the hospital, sleeping on the ground, eating breakfast, doubles for breakfast, lunch and dinner, while studying for exams, even though we were a year apart.
And mixing Lipton and coffee.
Mixing
Cot
tea, we call it.
We call it.
Yes. Dr. Spence, who I've also known for a very long time from high school. What got you into this field, this noble profession?
Well, my story starts actually when I was quite small. So I suffer with asthma and suffering from since 18 months. And by the time, well, my mom claims that from age 3 or 4, I was quite taken away. Doctors were able to ease pain, ease dis-ease, and in patients had like the ability to present myself at the casualty. There was be somebody there to take care, to guide me to get stabilization, etc. And I loved it. I love that. This is a good thing to do. It's a good way to serve my fellow man. And from age 3 or 4, I wanted to become a doctor. And that has not changed. And actually, while walking across to St. Mary's from where I live in Belmont, I used to say, well, I would go to Port of Spain General Hospital to work there when I'm growing up. It's a lifelong dream.
Excellent. Okay, so we're actually going to take a little break, and I think this is to adjust and to make sure we have seats for everybody on the panel. Let's take a quick break, go and pay some bills, and we'll be right back with hopefully a 6-member panel. See you in a few.
Sugar chubby with the same great taste. Flavors drink the more healthy way.
It tastes so yummy, chubby, chubby.
25% less sugar chubby. Be active, be healthy, drink lots of chubby. Kicking football, playing cricket, having fun in the sun. Reduce the sugar chubby, keeps you cool and refreshed.
It tastes so yummy, chubby, chubby.
25% less sugar chubby. Jumping rope, running races, have fun.
It tastes so yummy, chubby.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
Kid now by visiting www.fruitacoolkids.com.
Don't miss out on Amro's Carnival All-Inclusive Getaway, February 5th to the 9th in Boca Chica, Punta Cana or La Romana. Call Amro's Travel today at 665-3383, starting from $5,550 per person based on triple occupancy. No visa required, non-stop flights, eat and drink all you can. Limited space still available on escorted tours to Dubai, Abu Dhabi and India. Call Amro's Travel at 665-3383. Also available, great deals to Cuba, St. Lucia, Barbados, Grenada and Curacao. Visit Amro's Travel at Chagonas, Valpark, San Fernando or Port of Spain or online at www.amrostravel.com.
Remember the good old days when we had roti with rich, creamy butter? Eh?
Hey, give them a roti.
Greenfields butter, available nationwide.
Great news! With Trinidad Fresh, you get 70% real fruit juice, and it's available in fruit punch, orange, and apple.
Drink Trinidad Fresh. Reduce sugar chubby with the same great taste. Lots of magic fruity flavors, drink the more healthy way.
It tastes so yummy, chubby, chubby.
25% less sugar chubby. Be active, be healthy, drink lots of chubby. Kicking football, playing cricket, having fun in the sun. Reduce sugar chubby keeps you cool and refreshed.
It tastes so yummy, chubby, chubby.
25% less sugar chubby. Jumping rope, running races, have fun.
It tastes so yummy, chubby.
Drink the more healthy way.
For the everyday lowest prices on all grocery items,